Okay, well, let's get started. Welcome back, everybody, to another session of Ask the Doc. We've got Dr. Joe Mejia, once again, who's going to talk a little bit about stem cell therapy. So we're going to dig into that. It's a hot topic. My name is Steve Sargent, your host. And yeah, just excited to kind of dig into this. We get a lot of questions about regenerative medicine, the regenerative revolution, about stem cells in general. So glad you could join us. We're gonna jump right in. Dr. Mejia is the medical director at Performance Rehabilitation and Regenerative Medicine for over a decade now, and has really pioneered the regenerative medicine movement here in the Northeast and in New Jersey. And what I mean by that is he's been doing regenerative procedures, stem cell therapy, and others for almost a decade now, primarily extremity-based, knee, shoulder, hip, but more recently in the last few years, regen of the spine, going into the intradiscal space. And so we'll talk a little bit more about that, but let's just start high level about stem cells, because there's all kinds of questions and confusion about what stem cells are, why there's such an interest in them, what they do, how they're used. So Dr. Mejia, maybe just starting at the top, take us back to science class, take us back to bio. What are stem cells?
Sure. Yeah, stem cells are, a focus of a lot of regenerative medicine techniques. And the reason that they're so popular is that the stem cell essentially can differentiate into any cell that it's near. So, for example, if we're treating a condition like osteoarthritis, and you put stem cells near cartilage tissue, it can actually help to repair and regenerate some of that tissue. Just a disclaimer, though, to the term stem cell, and they're actually in the regenerative medicine world trying to get away a little bit from that topic, because stem cell is actually a lot more than just stem cells. In fact, there's a host of cytokines and other chemical mediators that will essentially recruit healing factors to that area, healing cells to that area. So not only may some of this, the samples include stem cells themselves, but they also recruit other reparative cells to the area to heal. Some of the conditions that we treat, as mentioned, are degenerative changes. Osteoarthritis being of the knee in particular, being one of the main indications for regenerative therapies.
So is it true, I mean, with some of those changes and learnings about stem cells and regenerative medicine, I mean, is it true that, there's sort of no other cell in the body that has the natural ability to generate new cell types?
Yes, I would say that, the power of the stem cell is just that, to be able to differentiate. You're taking like a young cell, so to speak, that hasn't really decided which path it's going to take, and you're kind of influencing it into whatever it's near. So there are other regenerative medicine techniques, but not to that level where it can actually differentiate. Things like platelet-rich plasma and things like that are another form of regenerative medicine, which can recruit stem cells essentially to the area, but they themselves are not the stem cells.
Okay, so we'll come back to that and how stem cells and platelet-rich plasma are used together in what you do on a regular basis. Sticking with stem cells in general, I mean, what's sort of your sense of the high level of interest, particularly over the last decade or two in stem cells? Other than, in addition to kind of what you just said, I mean, any sort of insight into that?
Yeah, I think, one of the main things that patients are looking for are being able to return to their function and in the most minimally invasive way. And regenerative medicine has definitely, in the orthopedic world at least, gained some steam over the past couple of years. I mean, it's been around actually for many years in other disciplines, but with regards to orthopedic medicine, definitely has gained steam over the past, I would say, 5 years or so. And the reason it is because it can really help to restore patients to their normal level of function, reduce pain, with pretty minimally invasive types of procedures. And our goal really is to preserve, the parts that are there, and hopefully avoid the need for any further surgical intervention, like a knee replacement or joint replacement, or even rotator cuff surgery, so to speak. There are a lot of regenerative medicine procedures that could potentially avoid those types of things. So, with these days, everybody's looking for less invasive options, basically, and more natural healing, and that's what we're just trying to tap into, is the body's natural ability to heal. Because I do believe that we do have that ability. Sometimes we have to kind of harness that capability and put it into places where the cells can't get to very readily.
Sure. Yep. Yeah, that's great. Well said. And I know that, just even outside of our space as well, I mean, there's a high level of interest in stem cells because they increase our understanding of how diseases occur, right? Just the research that's gone into this. Again, not just in the orthopedic space, but just in healthcare in general. And then, of course, secondarily, the fact that they generate healthy cells to replace diseased or damaged cells and have the potential to become new tissue, as you mentioned, which is fascinating. And that really is what regenerative medicine is, right? Is
Sure.
that ability. So, there are different types of stem cells that come from different places. What are the types of stem cells and where do they come from? And there's some controversy related to this as well.
Sure. Exactly. Yes. Stem cells, you can get them from several different sites. And depending on if it's from your own body, which is called autologous, or from somebody else, which is called allogeneic, those would include things like embryonic stem cells and amniotic stem cells, which are they are viable options. They are a little bit controversial. There's some ethical concerns with taking cells from a human embryo. And in our space, in the orthopedic world, I know there are some practices that do utilize those techniques, but our preference is not to. And that's mainly because we are able to control, if you take it from one patient, put it into another site on the same patient, we know exactly what was done. It was processed the same day in our office. There's no chance of contamination or anything like that, because with some of these other products, not only are they controversial, but they're manufactured in a lab offsite, and you don't really know what you're getting sometimes with the product. Not to say that they don't work, it's just that's a little bit out of our comfort zone, and we really minimize the chance of having any adverse effects when you take it from one patient and you're putting it in the same patient the same day with minimal manipulation.
Yeah. Okay. So when we're doing that, we refer to that as adult stem cells, right? Or again, autologous. So we're taking that from where? Fatty tissue?
Yes. Yeah. The two main sites are adipose or fat tissue and bone marrow or bone marrow aspirate concentrate. You could take that and actually concentrate it down. There are two schools of thought on this, and in our world, that there's no right or wrong, to be honest. Some people say yes, fat is the best source of stem cells, and bone marrow. On the other side, they say that they're the best also.
Sure.
When it comes down to it, they both have the ability to regenerate tissue where you're injecting it, and sometimes it depends on the patient. Thankfully, most people have a donor site for adipose tissue. So, but we don't, on patients that may not have much body fat, it would actually technically be very difficult to get adipose tissue from an extremely thin patient.
Okay.
So that's one reason. The other thing that we have to look at too is that there have been studies on the number of stem cells that are found in the bone marrow aspirate, and that tends to decrease over time. With age, unfortunately. So, 90-year-old patient will have theoretically a less number of stem cells to work with if you're taking from the bone marrow.
Okay.
Having said that, obviously there's a lot of variation, and you can still get very good samples from either of them. And then the other thing to consider too is what actually are we injecting? Sometimes if we're doing things like intra-articular for knee osteoarthritis, it may be preferable to have that consistency of the adipose tissue because it acts as a cushioning or lubrication actually for the joint. And that can be advantageous as opposed to bone marrow. Whereas if we're injecting very small areas, for example, the rotator cuff tendinous insertion, where you really need small needles to get in to begin with, and you need an injectate that is very easy to work with and thin, bone marrow is probably the better option there. Or if you're doing the spine, for example, intradiscal regenerative medicine procedures, it would be very difficult to inject adipose stem cells in there just because of the size involved, and you would need larger needles, obviously. And when we enter the disc, we want to use the smallest possible. So those are the two main types, and the choice really just depends on what condition you're treating and the patient.
Right. Yeah, fascinating. Lots of layers there and lots of variables. So it seems to be a very individualized, customized approach, which I know is how you treat every patient, regardless of the treatment plan or the condition, which is something that sets you apart. So let's just touch on kind of before we wrap up. That was a great overview of different types of stem cells, how they're used, and even conditions you're treating. You mentioned earlier, stem cells and PRP, platelet-rich plasma. How and when are those used together, and what's the reasoning behind that?
Sure. Basically, again, it depends on the patient. If there's very mild to moderate osteoarthritis, for example, or very small tears within a rotator cuff, we may get away with just platelet-rich plasma alone, because as we mentioned earlier, there's definitely regenerative properties, healing properties, even pain relieving and anti-inflammatory properties with it as well. So in those situations, platelet-rich plasma alone may be a decent option for the patient. When we use adipose, a lot of times we want to activate it, so to speak, and we may follow it up with platelet-rich plasma in that situation, whereas bone marrow often has a lot of the growth factors along with the injectate. So sometimes what we do with adipose-derived stem cells is add platelet-rich plasma. The stem cells, so to speak, are like the seed essentially, and platelet-rich plasma, because it's a host of growth factors and healing factors, kind of acts like the fertilizer for those stem cells to help, give them an environment to nourish and grow and differentiate.
Awesome. So let me ask you this. I mean, if I'm watching this and I don't know, much about it, or I know just what you've said, I'm wondering, how invasive are these procedures? Can you maybe describe the treatment? I realize it's going to be different for various conditions and, extremity based versus maybe the intradiscal space, but does this require hospital stays? Is it done in a surgery center, right in office? So tell us a little bit about that, just the procedures themselves.
Sure. The procedure itself, we block off roughly about an hour or a little bit more for the procedure, but typically it really doesn't take that long of a time either. It's all done under local anesthesia. Patients are kind of laying face down on the table. They don't really have to look at anything. It's extremely well tolerated. Even though, when we first start talking about it, particularly the bone marrow, patients are kind of, a little bit apprehensive because, it does sound invasive, and it is, but actually it is very well tolerated. With the use of local anesthetic, we use X-ray or fluoroscopy for the guidance, so we know exactly where the area is. There's not a lot of manipulation in terms of the angles that we need, because we know exactly where to get it, kind of in the back of the pelvis here, called the iliac crest. So actually very well tolerated. Most patients feel just a little bit of pressure as we're aspirating. They feel that kind of just a deep pressure there, but very well tolerated. And I would say for the adipose, when we get stem cells from adipose tissue, that's actually probably the one procedure that I do where patients want me to keep going.
Take it out.
Yeah, just keep going. Just take it out. So once you numb it up, honestly, that part is pretty simple. We do have to add some fluid into that area to remove some of the adipose tissue.
Okay.
But once it's kind of numb and you start extracting the fat tissue, patients, yeah, literally want me to keep going.
Yeah. So non-surgical, obviously, local anesthetic, right in office, right?
In office, yep.
So
And the processing takes about 15 minutes, and then we inject it just like any other injection in the office. Local anesthesia, always done under guidance, so we know exactly where to place it.
Yeah, awesome. Well, thank you. I appreciate it very much. Great presentation of just an education on what stem cells are, how they're viewed, why they're of such interest, and how they're used, particularly in the orthopedic space. And maybe just one last question is, what kind of results are you seeing? I mean, you've been doing this for almost a decade. I know there's a whole consortium. There's tons of research and data, driving these decisions. And I know you've had extensive training. What are you seeing? What's sort of your personal experience with it?
Yeah, I think regenerative medicine is a great option. Obviously, it's not a panacea for every condition, but when used in the right patient, the right timing, so to speak, because it's not always the first line treatment either. When used in combination with things like physical therapy, for acute pain, even a corticosteroid injection, for knee pain, visco supplementation. But as part of, that's the nice thing about regenerative medicine. It's part of the treatment plan, and it doesn't have to stand alone, by itself. So I think in a comprehensive non-surgical orthopedic plan for a patient, it definitely is on the algorithm to help patients, and the majority of patients that we do these types of procedures on will get results. I would say upwards to 80% of patients will get improvement, but the thing is, within that 80%, some people are getting lower percentages of improvement. Some people get nearly 100%. Mm-hmm. But in terms of, exhausting essentially all the non-surgical types of treatments, regenerative medicine definitely has its place, and that's why it's becoming so much more popular in our space, because people realize that there are things that you can do prior to invasive surgical intervention.
Yeah, it's one of those areas that really helps to fill that gap between conservative care and surgical intervention, right? And it's a wide gap that I think the average person doesn't really know exists. That there are so many options within that gap, and so thank you for what you do. Thank you for all of this information. And if any of you watching want to know more or want to explore regenerative medicine for a particular condition, obviously you can reach out right through the Facebook page or at performancerehabnj.com. So thanks again, Dr. Mejia, and thank you all for watching, and we'll see you in a couple of weeks for our next episode of Ask the Doc. Take care, everybody.
Thank you.